I think in my opinion, we're going to see the solution and cure of a debilitating disease that we thought that would be impossible to solve. With all of the advancements now happening with generative AI, I think you're going to see some new discoveries that were unattainable in years past.
So I'm very excited. This week in the US, there was an announcement that the government is going to put forth a bill to fund a significant amount of women's research. And this is such a game changer. The money spent on research to drive women's healthcare has been a pittance. And so I think looking at that, and if that passes through Congress, we're going to see technology reflect the move to get more women's information, more research around women, and then share that information across the healthcare ecosystem.
You know, I think we're going to see a rush towards people moving into platforming on FHIR using open standards. So whether it's fast healthcare interoperability resource and layering another open standard of clinical quality language or CQL on top of that, as the government is actually pushing people towards these open standard technologies. I think we're going to see it for two reasons. One is because organizations that are playing in the value-based care space, NCQA is already starting to run pilots to receive this data, not only on medical billing data, but also closer to the bedside on EMR data in order to get quality data reporting through. We're seeing that the new prior auth rule that just dropped in January, that there's people already running pilots on Da Vinci implementation guides, which run on FHIR and CQL. And I think because of AI, as you already mentioned, being on an open standard allows us to move forward into large language models faster because we're not training on proprietary data models. We have a fully documented open standard that can be trained on, so it allows our LLMs and our AI tools, especially on the consumer and the provider side, to move faster. So I think in the next 6 months, we're going to see a whole lot of activity for payers, providers, and pharmacies moving into open standards in their data infrastructure.
Yeah, I think, if you look back to the last 12 to 18 months, there's been obviously a lot of interesting developments in AI and generative AI specifically. I think the next 6 months will allow us to really think about how do we put those models into action. There's a lot of work that needs to be done around bias and equity to be able to put those models into production. So we'll need to think a lot more closely around, what are the models and the data sets that we're training on? Are they big enough to handle the hidden biases that exist in the population? I think this will also lead to a conversation around transparency in how we build models and explainability. It's not really good enough to just have the highest accuracy in our models. We really need to work with the clinicians to have explainability and kind of explain to them that here's what goes into the models and why they're performing the way that they are. I think it really starts with inclusive development, right? So it's not just the data scientist's job to build models. It's really a joint effort with the clinicians. They can help out with target definition, feature engineering, clinical validation. All those things, I think, will lead to a more inclusive and better patient experience ultimately as these models get into production.
I think there's real momentum around CIOs and CNOs understanding that they need a comprehensive, integrated solution focused on workflow efficiencies. And so dynamic clinical workflow is really an exciting conversation for them because they understand to continue to provide the quality of care they need, they really need to think about the technology around the patient, around the bed, and around the nurse.